Yesterday, we reported on a BC Ministry of Health document that says that a significant portion of opioids prescribed by doctors and pharmacists are being trafficked provincially, nationally, and internationally. The leaked document also says that the ministry has been conducting an investigation with next steps including targeting specific pharmacies. Adam Zivo, columnist with the National Post and founder of the Center for Responsible Drug Policy, joined us for more.
The leaked presentation was given by the Ministry of Health to law enforcement officials at the end of December 2024, and it appears that it is still being circulated throughout the provincial government even today. Now, what the presentation states is that a significant portion of the opioids being distributed through Canada's Safer Supply programs are being diverted to the black market, and they are being trafficked provincially, nationally, and internationally. Additionally, the presentation is focused on the role of pharmacies in facilitating this system of fraud and overbilling the provincial government. For context, a pharmacy can make much more money from a single safer supply patient than most other patients. And that's because a safer supply patient will come in every single day and pick up three different medications. And when you have a patient coming in picking up three medications every single day, that means that a pharmacist can make a ton of money off of a dispensing fee. Essentially, that is a flat fee that is charged to the provincial government for every prescription that is filled. So, for example, in Ontario, addiction physicians who I've spoken with have estimated that a single pharmacy can make $1 million in fees with just 100 safer supply patients. Or to think about it another way, if you have a stable patient on methadone, which is a traditional opioid medication, they may only have to pick up their medications once or twice a month, versus once again picking them up every single day. So the BC government basically hired, well, they had their special investigations unit come in, and they identified over 60 pharmacies that seem to be abusing the system by paying kickbacks to doctors and to other social support workers to pressure patients into going on safer supply, even when these patients don't want or need safer supply. And so now you have vulnerable individuals who are being pressured into defrauding this program, and then they get these drugs, and then they sell these opioids on the street to organized crime. And then that ends up in the hands of everyday Canadians who then become addicted to opioids and escalate to fentanyl and then potentially die. Uh, the the really astonishing thing about this presentation is how it validates reporting that has been done for over 2 years, warning about this issue. So I've been reporting on safer supply diversion since May of 2023. And at this point, I've written over 50 articles and commentary pieces about the problem. When my reporting first came out, the BC NDP and the federal Liberals insisted that I was lying and fear-mongering, and that anyone who believed my reporting was peddling disinformation. It was a really difficult time. It is hard as a journalist to go up against the federal government when the federal government tells you that you are lying, even though you know from your interviews and from what you've seen with your own eyes that this is the truth. Over time, the BC government was forced to admit that this is a real problem. So, for example, in the beginning of 2024, BC's public health officer, Dr. Bonnie Henry, released a report based on interviews with a large number of addiction doctors and people with living experience with drugs. And she was able to confirm that diversion is a common occurrence. Yet, even so, Yara Sachs, who is the federal minister for mental health and addiction, claimed about 2 months later that opponents of safer supply are merely peddling fear and stigma, right? So we have this consistent gaslighting. And now, with the publication of this presentation, we know that not only has the public health officer recognized that diversion is a real thing, the BC provincial government is actively investigating this problem and has confirmed that it has an international scope. So I think the concerning thing here is that were it not for the fact that this presentation was leaked to the public, we might not know that this was actually happening. And the provincial government has cited, I guess, operational security for their investigation as a reason why they haven't shared this with the public, but the public has a right to know because this is a contested debate with national implications, and disinformation has been spread quite aggressively by the BC NDP and federal government saying that this does not exist. So I am concerned by the lack of transparency here. On top of that, I wonder if there will be any real accountability, given that the very people who pushed for safe supply so aggressively are now tasked with potentially overseeing, this investigation. I think that we should have a public inquiry, but I don't believe that the BC NDP will call for one because of the potential political and legal liabilities. It would obviously be devastating for the BC NDP to fully recognize that this addiction program that they championed so aggressively for years has actually been an absolute disaster and has made the overdose crisis worse, not better, and very likely harmed a large number of children. I think also, if they were to recognize this, this would open them up to a large number of lawsuits. There is currently already a class action lawsuit against the BCNDP by Greg Sword, who is the father of a young girl, Camilla Sword, who died 2 years ago at age 14 after developing an addiction to safer supply drugs. So him, as well as her friends who also developed these addictions, are suing the BCNDP. So acknowledging that this is a problem through a public inquiry would be like shooting oneself in the foot.